lot of the concepts that I had learned in medical school, specifically around nutrition, were not actually evidence-based, which was very disturbing to me. Really blew my mind. I was like, oh, we're supposed to be healthy. It's not like this inevitable thing that there's disease that we have to fight, which is sort of the mindset for me and that I learned in medical school. I got very interested in that, started changing how I ate, started to feel better myself, have more energy. And then eventually that led me to studying functional medicine. Once you learn that kind of way of working with people and you see the profound impact it can have, you kind of can't go back. Patients are usually looking for another option. They are often frustrated by where they've gotten with conventional medicine. Either they've been taking medications that haven't worked very well or have had a lot of side effects, or they know deep down there's got to be a better way and that they want to achieve real root cause resolution, real healing, and not just mask the symptoms with medication. I guide patients and I teach them how they can help themselves and heal themselves. So they're very empowered and they enjoy not having their future in someone else's hands so much, but being able to direct their own path. So in my practice, I'm able to spend time with you, really get outside of that model of seeing 30 patients a day or something. We have the time to really talk. I can hear your story. I can find out what are the pieces of the puzzle that are contributing to how you're feeling now. Usually we are going to be doing advanced testing to figure out what are the hidden causes that we can't see that are contributing to inflammation or nutritional deficiencies. We're going to do a lot of education and support to help you make the lifestyle changes that are going to get you well. In my practice, we address a broad array of symptoms because sometimes the symptoms aren't telling you the cause, and that's what I really love about functional medicine is you're addressing the whole body, and the patient may have, digestive complaint or brain fog, but you're actually helping heal the whole system when you address the underlying causes. I also like to help people who don't realize yet that they need this kind of treatment, and when they start to realize, oh, my parents have Alzheimer's, or there's diabetes in my family and I don't want to get there. This is starting decades before, and that we can really change the trajectory of their health, and it's easier early on. That's a very exciting thing to do and help you with. So my approach starts with an initial consultation, but really it starts before you come in the door. You're going to be filling out an extensive questionnaire that's going to provide me with a lot of details of your health journey. Then we're going to make a personalized treatment plan with testing recommendations, diet and nutrition recommendations, stress management approaches, and lay out a framework for your healing. So in my practice, we really include a full amount of support. When you participate in my program, it's going to be very comprehensive. It's like 4 visits with me after the initial consultation for follow-up and adjustment of treatment plan. And it's also 10 visits with the lifestyle therapist to implement all the changes and get the support to make these changes lasting and an easy part of your life. It's an investment, but when you start to think about what's it worth for me to play with my kids without pain, or to avoid Alzheimer's, or to be able to grow my business because I have energy now, suddenly it's well worth it. As a program member, you can come to monthly classes that we hold live in our office on various health topics, which is part of creating community, which helps people implement changes. There's a lot of wonderful self-help books out there, but the process is so much slower and people can go down a lot of dead ends. And if they work with a practitioner who can guide them, the process can be so much more efficient and in the end save them a ton of energy, a ton of money, and really just yield better results. So for people who want more information, you can go to my website, Catalyst Health CFM, that's for Center for Functional Medicine.com. And from there you can just click on the links to join our Facebook group. You can also download some guides and begin to receive emails from our program.